severe obesity in kids. The use of modified ATP3-defined metabolic syndrome and severe obesity as predictors of insulin resistance in overweight children and adolescents, a cross-sectional study in Cardiovascular 2007 February 14 6-4 by Tupares, Cohen H.W., Daniel J., Gumidyala P., Agar Ola V., St. Victor R., Tupares. The rising prevalence of obesity and metabolic syndrome has received increased attention since both place individuals at risk for type 2 diabetes and cardiovascular disease. Insulin resistance has been implicated in the pathogenesis of obesity and metabolic syndrome in both children and adults and is a known independent cardiovascular risk factor. Measurements of insulin resistance are not routinely performed in children, while metabolic syndrome or severe obesity, when present, are considered as clinical markers for insulin resistance. The study was undertaken to assess the utility of ATP-defined metabolic syndrome and severe obesity as predictors of insulin resistance in a group of 576 overweight children and adolescents attending a pediatric obesity clinic in Brooklyn. Metabolic syndrome was present in 45%, 48% and 42% of the respective age groups and significantly predicted insulin resistance only in the oldest group. The expression of insulin resistance in overweight children and adolescents is heterogeneous, and metabolic syndrome or severe obesity may not be sufficiently sensitive and specific indicators of insulin resistance. In addition to screening for metabolic syndrome in overweight children, markers for ER should be routinely performed. Further research is needed to establish threshold values of insulin measures in overweight children who may be at greater associated risk of adverse outcomes whether or not metabolic syndrome is present. Definitions of metabolic syndrome vary, and I suggest there should be a broader classification of metabolic syndrome now that we can find metabolic impairment. This includes research that I have done testing respiratory quotients to see if a person can process carbohydrates. According to a study in Cardiovascular 2006 July 4-185-97 by Daskalopoulos SS, et al., it is a cluster of metabolic abnormalities. It includes abdominal obesity, glucose intolerance, hypertension and dyslipidemia, and is associated with an increased risk of vascular events. Since the initial description of the metabolic syndrome, several expert groups produced different definitions. This variability led to confusion and absence of comparability between studies. Although there is agreement that metabolic syndrome is a major public health challenge worldwide and consistent evidence demonstrates the need for intervention, the definition of the syndrome needs to be revised.